Lovely. Okay. Hi, everyone. My name's Adele. What I'm going to do now is just set up my screen so I can share my slides with you today. So just give me a moment. So hopefully you can all see my slides now, and I should be in the corner. Hopefully all of you can see me. So as Victoria said, I am very much more used to talking to people in a room. So I kind of still talk as if you're all here with me in the room. And I've put together sort of a little session today based on some slides, so kind of like a mini webinar. And what I'd really like to do though is save a lot of time at the end to hopefully answer some of your questions. So as I go through, please do ask any questions in the chat, direct those ones to Anna if you can, or to myself if there's something that you'd like me to cover but didn't want to mention, and then we can have a chat about it at the end. So obviously I have just click on my next slide. So I think we've covered most of these things, but I guess it's important to mention that there might be some sensitive information discussed. So I know you would all listen with respect if that was the case. And yeah, please do ask any questions that you have. So like Victoria said, I'm a cancer dietitian and I've just moved down under, so I'm a little bit further south, but I'm still carrying on a lot of my UK-based work before I sort of work out what the next steps for me are. I have almost 10 years working in cancer in the NHS, and I had the privilege of working with lots of people who had ovarian cancer. So I've also worked on research projects within looking at diet changes with ovarian cancer as well. And then I've kind of moved a little bit digital, hence the sort of with the pandemic, but have moved to sort of what we call health optimization alongside cancer treatment. And that's kind of one of the things that I'm really passionate about, everyone having access to things like a dietitian or appropriate nutrition information, activity information, and I know you guys are going to have a session on that later if you choose it, psychological support, because it all kind of fits in together, I think, to help you live well whilst you're living with ovarian cancer. So I'd really like to hear from you all in the chat. I can see some people are writing. I'm just going to open up the chat. And I like to sort of break the ice. Tell me in the chat what your favorite foods are or favorite food is. And I'm going to start. Mine is pesto. So I'm a pesto nut. I love pesto. So what do we all think? Add in the little chat. Peanuts, here we go. Cheese, aubergine. They call them eggplants down here. I'm having to get used to that. Avocado, nice. Indian food, chocolate biscuits, curry, chicken salad. Oh, bananas. Chocolate, Thai curry. Brilliant. Oh, we're having lots of different answers here. Seafood, prawns, love some prawns. Cottage cheese, delicious. Or homegrown tomatoes, that's a definite goodie. So it looks like, I mean, lots of you like loads of different things. And I think that's really where I want to start, that with nutrition, there is so much information out there. It's really about picking out what you need for you. And that will be different for everybody in this room. Just like your likes and dislikes are completely different, there will be things that are specific to you. So today is a very general overview of sort of what we know, what we don't know about eating and ovarian cancer. But I kind of want you to be aware that there's still lots of ongoing research and it's making food work for you. So I guess that's sort of what it really shows, is everyone likes different things, and it's important for us to be able to sort of work out what happens, what we need for ourselves. And hopefully by the end of today, you'll have a bit more of an idea and feel a bit more comfortable about food, because that is, again, something that I'm really passionate about. So some more questions. I'm wondering where you guys get your nutrition information from, sort of what you found helpful, what you may not have found so helpful. Also, if anyone's seen a dietitian or knows the difference between a dietitian and a nutritionist. And then what do we know? So what does some of the evidence say about nutrition and ovarian cancer? Or someone said chocolate and butter. I do like butter too. Does anyone have anything that they wanted to share? Everyone's nice and peaceful. Yeah, it says people looking YouTube. And it sounds like someone did see a dietitian. So I think there's lots of nutrition information out there. So what I've done today is hopefully summarize some of that for you. And just to let you know that as we go along, all the references are at the end of the session, and there's some further reading for you, sort of some things that I've come across that I find really helpful to suggest to you. So what we mostly know, there's a comprehensive summary of the studies for nutrition and ovarian cancer that's produced by World Cancer Research Fund. That was produced in 2014 and then revised in 2018. So a lot of the sort of evidence base that I've pulled is from there. But unfortunately, there's a lot that we don't know. So there'll be some sort of general cancer nutrition things that I'll put through the session today too, to hopefully give you a little bit more of an overview. And I'm always very honest about what we don't know or what we're researching, and hopefully we'll find out in the near future. So do ask if you have any questions. And I can see that someone had spent a little bit of money on a nutritional scientist who seems to have excluded lots of things. And I'm very much more on the things to include more of rather than any restrictions. But that being said, someone had mentioned they had to follow low fiber for a while. And that's again something that I want to talk about through the session, because I know a lot of ladies need to adjust the fiber in their diet at different stages during their treatment, surgery, or with things that might happen, some of the side effects of ovarian cancer. So that is going to be weaved through the session today. So again, the difference between a dietitian and a nutritionist. So dietitians, we're registered, we follow a code of conduct and have done a 4-year degree working with sort of in hospitals with clinical patients. There's very many nutritionists out there that are very well trained to a similar degree to myself, but there's also lots that aren't. So there's not a dietitian, the name is protected in the UK, whereas a nutritionist, unfortunately, the name isn't protected. So you can just make sure you're asking where you're getting nutrition information from. That's part of you being able to advocate for yourself, making sure you're getting the information that you need. So what I've done today is put together a little fact and fiction to hopefully answer some of the common questions that I get asked when I do similar sessions like this. And obviously you can't yell out, but do feel free to add in any comments in the chat. And I can see that someone's mentioned about tomatoes and red peppers, and we'll come to fiber a little bit later if that's something that you all do want to know a little bit more about. So this is a diet based on plants is a good approach. So do we think that's true, or do we think that's false? What do we think? And yeah, there's so much conflicting information. Yeah, true. Okay. And I think that's right. So a diet based on plants is a good approach. So what I'm not saying is that you need to exclude animal products altogether, unless you want to. That there's no evidence that being a vegan or vegetarian have any benefits to having more plants. So it's having more plants, but not exclusive, but again, unless you want to. So the other questions that I've added on here are common questions that I get asked for ovarian cancer ladies. Are phytoestrogens safe for me? And is soya safe for me? So I've put this in this section, which often surprises people because some people are a little bit cautious about phytoestrogens or soya. And I guess, first of all, what I want to say is phytoestrogens, I would usually ask you what you knew about them, but they are plant chemicals that look very similar to estrogen or other hormones in our bodies. But actually the thought was that these might be promoters for certain cancers. But actually most of the evidence is showing that they're probably safe, and that they are safe, and they're probably protective. So they're generally found in plants. So when we're looking at plant-based being a good approach, so are these types of foods. So things like soya, linseeds, other sort of plant-based foods that have a wide variety of chemicals in there are a good thing. So you're getting that whole rainbow of things. The thing is, for some of you, you might be following a more restrictive diet at a different stage. So it's having what you can have. And it might be working around some of that. You might not be able to eat as many fruit and veg as you would want to, whether it's due to a symptom, which we'll come to at the end, or if you're having a diet because you just had surgery or you've had a bowel obstruction. So these are very individualized. So the advice might be, yes, plants are a good thing, but if you need to follow a low fiber diet, you're going to need to lean on other foods that are maybe not as plant-based. So it's very flexible, if that makes sense. So not exclusive, and it might not be possible for you, very symptom dependent. So someone's just said, I want to be vegetarian, but my warfarin nurse had said that's not a good idea. I would say head back to the team who looks after your warfarin, because there is ways that you can increase your vegetables. They just need to monitor you in a different way. So it's not a contraindication or a no to be a vegetarian with warfarin. It just needs more monitoring whilst you step up some of those vitamin K containing foods. So definitely speak to your team, because they should be able to meet you in the middle somewhere, I would definitely say. And then any questions about soya or phytoestrogens, do let me know, and we can chat about those if it's something that you want to know in a little bit more detail. So what about superfoods boost immunity? Do we think this is true or false? True. False. Controversial. Getting a bit of varied answers here. No idea, like that. All foods have different properties, very true. So actually, it's a little bit of a trick question, because there are no superfoods. So I would always think you're looking for a super variety-filled diet rather than individual foods. Excuse me. So what you're looking for is, don't worry about selecting certain foods in your diet, and what we want to use is a wide variety of foods to help support your immune system. Individual foods or a good diet unfortunately can't boost your immunity, so what we're looking for is good nutrition support. And again, that will mean different things to different people, but for most people, they're often quite surprised that protein is one of the most important nutrients for our immune system, and to help us recover and prepare for treatments and recover from treatments as well. So protein foods, meat, fish, eggs, beans, soya, nuts, seeds. I feel like I'm missing a few things, but those kind of things are where your protein foods are, and they're really something that actually we all need to have a bit more of when we're having cancer treatments, especially if we're having certain ones like recovering from surgery or things like that. So that would be something that I would definitely recommend. The other thing is, it's just having the colors from your fruit and veg and other foods that are really going to give you that wide variety of things. You don't need to select certain sort of foods that you feel they're often used in a marketing way, and generally have a hefty price tag on there. So, and I'll come to the pulses in a moment, Iris. What we've got, I've also put here, do I need to take supplements? So that's a common question I get asked as well. Not sure what you think, but generally for most of us, food first is the best approach. But for many of us, there'll be supplements that you might need if you have a deficiency that's diagnosed. Might have iron deficiency. Many of us, actually, depending on the treatments we're on, might be on calcium and vitamin D. All of us in the winter months should take vitamin D. So everyone in this Zoom room should be on some vitamin D. And I would always chat with your pharmacist for the dose that you need to be on. So pharmacists are a great resource to tap into. They know the drugs that you're on, and they'll know any interactions that might be. So we worry about you taking high doses of supplements when you're taking treatment, as they might counteract with some of the treatments you're given. So always run it past your pharmacist if there's something you want to take. And your oncologist, most of them will let you say, be happy with you to take a sort of an A to Z multivitamin, but always run it by. The other example that I like to use here is probiotics as a supplement. So for many of us, probiotics is something that can help boost our gut health, and more support our gut health, I should say. But there was a study that showed patients who were given probiotics with immunotherapy, so a therapy that uses your body's immune system to target cancer cells, actually dampen down the response to the immunotherapy. So we're just really quite cautious about supplement use alongside active treatment. That said, when you're not on active treatment, you might want to be a bit more flexible, and that's something that you might want to discuss with someone who knows your case and what you want to do or to try. And yeah, someone mentioned Fortisip, and definitely if they're prescribed, then that's then go for it. The other thing is, I'm also well aware that a lot of people don't always get access to see a dietitian, depending on how they are. And I've got some boosts at the end, sort of nutritional boosts, which kind of like own versions of Fortisip, if it's something that you think you might need. So we will come to that. And someone's asking about organic fruit and veg. I don't think I talk about that yet. So organic fruit and veg, you don't need to buy organic fruit and veg unless you want to. There hasn't been any evidence that's showing an effect on cancer risk or prognosis. There are pesticides used in organic as well. It's just different sorts. So if it's something that helps you eat better and you feel that you want to eat organic, then go for it, but don't feel you need to due to the cancer diagnosis. So it's something that you might explore for ethical or environmental reasons, which is again something that we may need to consider, but if there's the cost implication can be quite high. So don't feel that it's something that you need to do unless you want to. I'm going to talk, so supplement now, I just want to make sure I've talked about everything with supplements. Yeah, talked about all those things, great. I guess the other thing to mention here is that there's trials ongoing all the time with nutrition as a sort of a complementary arm to standard treatments. So things are happening. So do keep your eye on sessions like this. I always reflect on the evidence before I deliver a session like this to be able to see what's around there. So things are always changing, the evidence base, but generally food is always a support alongside treatments that we do know work. So watch this space. So someone's asked, can I eat probiotic yogurt if I have antibiotic allergies? Yeah, no, that's a great question. So antibiotics are drugs that target a bacteria in your body. Some of them target specific bacteria, some of them target general bacteria, which would include the good and the bad stuff. A probiotic is introducing a good bacteria into your body. So if you're allergic to certain antibiotics, a probiotic should be absolutely fine for you, but I would just ask your pharmacist just to double check. But you should be fine. And then we layer on a whole nother name, which is a prebiotic. So a prebiotic feeds the probiotic, the good stuff. And prebiotics are fiber. So fibers feed that good gut bacteria in your gut. So if you were ever on antibiotics that can kill off the good stuff and the bad stuff, that's why you might again choose to try a probiotic in that environment. The BDA, and I think I put it at the end, but now I'm not sure. If you search BDA food facts, probiotics, so the British Dietetic Association, they do loads of different food facts. They've got one on probiotics, and that's a great explanation on what they are, how you might want to try them, and it would definitely be suitable for all the ladies in the room to give it a go. Excuse me. Omega-3s, okay, I will talk about that on this page as well because it's a supplement. So omega-3s are a type of fatty acid that is generally found in the diet in fish, but also in marine-based oils. So actually it's the fish eating the marine-based oils that make the fish oils. So there is options whether you're a vegetarian or vegan, or you eat fish, to have oily fish. That is a good part of our diet. It helps helps support pathways that dampen down inflammation in the body. So they're a definitely good thing to include in the diet. Regarding supplements, it's again something, if you're going to take high dose, I would just run it by your oncologist. Most of them would support it, I would say, but I can't give you the AOK, so just run it by them if it's something you want to try, as there may be some evidence on it supporting an anti-inflammatory response in the body, which could be a good thing. If you're off treatment, then they're okay. So it's something that you might want to try. And again, there's marine-based omega-3s as well, if you're a vegetarian or vegan or would prefer that sort of source of supplement. So on sugar, here we go. Someone's asked the question, it's coming next. So this question comes up all the time. Does sugar feed cancer? What do we think, true or false? And if I've missed a question, which I think I did, I will come back to them, so don't worry, or Anna can help me come back to them. Thank you. So does sugar feed cancer? Okay, so we're getting a few different answers here. Yes, false, false, yes, true. Okay, so already lots of different answers, and hopefully we can spend some time to sort of unpick this a little bit. There's someone in the waiting room. Should I let them in?
We've just asked them to rename themselves. So we can
oh, okay, cool.
So that's all right.
Excellent. Okay. Just see them there. Okay, so does sugar feed cancer? Already we can see there's lots of different answers. So sugar itself is a carbohydrate. So all of our body's cells use sugar, including the cancer cells. So sugar often is called, well, body breaks it down to glucose. So if we're looking in a scientific way, then sugar feeds cancer, yes, but. So there's a big but on here. All nutrients that your usual body cells would use, including sugar, fats, protein, vitamins, minerals, including those omega-3s, all would be used within the cancer cell metabolism as well. So whilst we do know that the energy source includes sugar along with all the other nutrients to build a cell, cutting sugar out in your diet doesn't starve the cancer cells. So that's where the difference lies. So it's what I usually say is, for some people, you might want to explore different types of sugary foods. So complex carbohydrates, they're often called long chains of sugar. So they're things like wholemeal bread, pasta, rice, and they're long chains of sugar that take a bit longer to be absorbed. So they usually keep you fuller for a bit longer. They're often fiber rich as well, and they're plant-based. So, you know, those kind of foods are going to give you a bit more energy for longer periods of time. But if you're excluding carbohydrate or sugars altogether, it's not going to starve the cancer cell, and it's more often going to starve you. So what can happen then is you can actually start to break down muscle. And what we know is muscle is very supportive to help you prepare and recover from treatments. It helps reduce your toxicity or how you respond, side effects to different treatments. It's really important for recovery from surgery. And actually what we need to do is give you whatever that helps support you to have whatever that good diet is for you at that stage, to support you so you can have the treatments that we have evidence that do work. So it's a little bit tricky to sort of navigate and unpick that sort of discussion around sugar feeding cancer. And when we look then at supporting our body, and especially if we're having some side effects, we might be on chemotherapy, feeling really nauseated, and actually sugary foods might be all you can have to actually get the energy that you need to recover. So what you're wanting to do is find out how you can make energy foods work for you, because the other questions I've put on here is what foods can help combat cancer-related fatigue, and does sugar affect menopause symptoms? So if we start with cancer-related fatigue, a lot of people, especially women, we're chronically underfueling ourselves with energy, really struggling to do the things that we want to do. So having enough sugary foods, generally more complex foods, but there's a place for all foods, is making sure we're having enough regular energy foods to make sure we're meeting our needs. And protein fits in there as well. It's probably combining some energy and protein foods, excuse me, to help meet our needs. Oh dear, it's like a whooping cough. Oh. And then I also like to mention about sugar affecting menopause symptoms. So this is often a cycle that can affect all of us, even with cancer-related fatigue. We can find we're tired, we crave sugary foods, it gives us a rush. We don't really follow that up with anything substantial, we crash down. And that sort of circle of food can actually impact menopause symptoms as well. So if you're finding that you're struggling with hot flushes, fatigue, lack of sleep, actually getting adequate energy in the day that can include carbohydrate foods is important. Sorry, I just pretty much splurted all that out at you. So what have we said? What about surgery sweets? I think that might mean sugary sweets. And there's no bad foods. It's all about making things work for you. So if you aren't enjoying the food that you're eating, so if you're having sugary foods because you're very tired or something like that, then maybe it's working out what your body, what you would need, and saving the sugary foods for a time when you can enjoy them. So food for most of us, for most of the time, we want it to be stuff we can enjoy. We want to be able to enjoy that dessert when we're out with our family, that birthday cake with our kids, those kind of things that we want to be able to cherish those memories. So it's incorporating and not being scared of the food that you're eating, and sort of making peace with sugar. Some of us might feel that we're having too much, and it might be something that they want to address. And that might be something that you want to speak to someone about, how you can actually make that goal achievable for yourself. But it's not something that you need to avoid. And then that's a great question. Someone's just asked about artificial sweeteners, and that often comes with this. So artificial sweeteners, again, they're very well tested. It's something we've got a good body of evidence for that they're safe. They can have a laxative effect. So it's just a FYI. But if you're wanting to have less sugar, sweeteners can be an alternative to help you make that journey. But for some people, they'd rather have sugar. So it's definitely an independent decision, but whatever you choose will have a safe, you know, I mean, I've got a Diet Coke here. So there's most dietitians in the UK function on Diet Coke. So if you want to include sweeteners in your diet, then go for it. But again, yeah, someone's said that's conflicting information, but I mean, I've delved into it. I can tell you can safely have those sweeteners as long as they're not giving you any tummy upsets. It's because some sweeteners are a prebiotic. So again, a little bit of a crossover there. Now we're going for time. Okay, all good. And yeah, that's true. Someone said they're finding they're having more sugary foods during chemo, and then they'll have what's considered more healthy foods at home. And that's so true. Often if you're on a cycle, things change, and we're looking at that overall. So we're looking for you to be able to maintain your strength and your weight during each chemotherapy cycle. And it's looking at the balance of things over that 2, 3, 4 weeks, depending on how long you're having your chemotherapy cycle. It's going to look different for everybody. Let me just make sure. Oh yeah, got that. Sorry. So other questions that I commonly get asked: should we cut anything out from our diet? So hopefully you will have an idea that I would be saying no. There isn't anything that you need to cut out from your diet unless you've got a sort of diet prescribed by your team. So the common one I see is people maybe having less fiber, lower fiber, higher protein diets, higher energy diets. And I've got some information on the next slide about if you're struggling to meet your needs. The only thing that I often talk about in this section is alcohol. So I often get asked about alcohol and what the advice is. There isn't much specific advice around ovarian cancer, but when we're looking at cancer in general, there is more of a risk with alcoholic drinks. And unfortunately, there isn't any safe drinking level that I can give you. So the government recommends 14 units or less for men or women per week. If for many sort of cancer patients, we're often looking at less than that. So it might be, nice guidelines, the government sort of guidelines have been specific with breast cancer patients and said less than 5 units a week. So if I was going to go anywhere, I would say around that as a recommendation. If you choose to drink, I always say pick the drink that you like so that you enjoy it. If you're not enjoying it, then it's something that you might want to look at your relationship with alcohol. Many people during the pandemic, during a cancer diagnosis, lean on different things to help them cope. And if you're finding that alcohol is one of those things, I would always suggest you seek some help. These aren't the things that you should have to just try and manage yourself. And there's lots of different resources out there if it's something that you wanted to. I'm happy to direct you some places as well. So that's the only sort of thing that we might need to limit in our diet for most of us. And that's for most people anyway, and something to mention. And someone's just asked about dairy products. So dairy is, I do normally mention that. I would have put that in the plant-based approach. So you don't need to exclude dairy. We know dairy is safe. It's one thing that we've got well documented on. So we've done lots of research on it, which is a good thing. Dairy has loads of nutrients in it, protein, vitamins, minerals. You know, it's really nutrient rich, especially if you're struggling with your appetite or needing a bit of a protein boost. But I'm very well aware that for some people, having dairy isn't something they're comfortable with, even if they know all the evidence might be there. Or you might have an allergy or an intolerance to different parts of the dairy or lactose. So there's loads of dairy alternatives. It's making sure you're getting the calcium and vitamin D in that dairy-free drink. Organic dairy-free drinks in the UK often aren't fortified with anything, so they're just soya milk with no Vit D or no calcium. Sorry. And if you're looking for a protein substitute, soya milk is the only one comparable to dairy. And again, the British Dietetic Association do a good soya diet sheet, food fact sheet, if it's something you want to explore more of. But other milk products, if there's something you want to include, they're plant-based. So that's a good thing too. So there isn't an exact answer. Dairy is safe, very nutritious, but there are also loads of other alternatives if that's something that you wanted to try. So I think the other thing that I wanted to mention on here when we're talking about cutting things out is just, there's often sort of, you know, do you need a chemo diet? I get asked it quite a lot. And actually most of the evidence for all of us now is to follow a food safety diet. So foods that are in date, stored correctly, rather than sort of reducing the risk of foodborne infections, rather than you needing to follow a specific diet when you're having certain chemotherapies that was a little bit more old school. So that's another common question that I get asked. Okay. So before we finished off with all the questions, I just wanted to sort of give you a few ideas, because most of my day is often helping people meet their nutritional needs when they're struggling with different symptoms. So I would always suggest that if you've got a new symptom that's impacting your appetite, that you do try and talk to your team or a dietitian, or ask for some support from somewhere, because there's usually a reason why appetite is dipping. So I often see, and I think someone mentioned it, constipation as a massive cause of poor appetite. And actually, then if you want to eat and eat more, you're actually might feel ill. So it's starting at the bottom and then helping things move through easily before you're actually able to meet your needs orally. But here are loads of suggestions on ways you can fortify your food. And I've tried to put little stars next to anything that's more high fiber. So if you're following a low fiber diet or fiber manipulated diet, less skins, seeds and pith, then they're the ones that probably you need to make sure you're selecting from the information that you've been given from your team. My top tips are around staying in your own lane. what worked for someone else might not work for you. So do, listen and take on board different information, but it's always going to be what works for you. Work with the symptoms, make sure you're treating any symptoms that you have, because that can usually help you eat a bit better. Most people undergoing cancer treatment will need a bit more protein. So often we traditionally have protein twice a day, but I would actually up that to 3 times a day for everyone. Anyone can have malnutrition at any size. So if you feel you're losing strength, losing weight, but especially muscle mass, make sure you lean on that nutrition support advice, because unfortunately I see far too many people that are of a higher weight lose muscle mass, lose weight, and actually it takes them a lot longer to get access to the nutrition support that they need. But we want any size that you are to stay that size for your treatment and beyond, because we know that support is really important. And do ask for help. So every service will be different as to what you have access to, but you should be able to access some of these services. And something like, I don't know if you will have heard of prehab, sort of where I'm working now, is being able to implement those things that were thought of as rehab and afterwards support. Actually, we want them to start far further as you're diagnosed, as you're having chemotherapy or surgery. We want to be able to support you to be as well as you can early and upfront. And often many of us will always need to lean on our psychological support colleagues as well, definitely. Okay, I'm just going to skip through these and then we can do some questions. So this is me. If you have any questions, I'm always happy to answer questions, direct you to somewhere. I'm on social media and email, and very happy for you guys to receive a copy of these slides. These are the references on the left, and then some further reading on the right. I think I've done that the right way around. So if you're into a lot of the sort of sciencey stuff, start on the left, but then there's some really great resources on the right that I find really helpful to suggest to people to get you started. And what I'll do then is stop sharing, and then we can do some questions. Is that all right? Yeah.
Great, thank you ever so much, Adele. That was really, really helpful and covered so many questions that regularly come up. So we really appreciate it, and thank you ever so much.
Well,
so I'm just going to run through some of the questions that have come up.
Lovely, thank you, Anna. I know I got some of them as we went along, but I know I missed a lot of them. So
it's been, I think, it's a reflection of how important the topic is and how interested people are. We've had so many questions come in. So one of the questions was, is there any guidance for eating to work with a stoma? So when you have a stoma, and I think my colleague Molly's just going to drop in some information we have on our website about that into the chat. But if you could speak to that, that'd be great.
So every hospital or team should have some information for you, because it's going to be very dependent on where your stoma is located as to what your needs are and what your output is like. So I would always say, if you're struggling, you should ask for some help from get an adequate referral. It might not be a oncology dietitian that you see, it might be a gastro dietitian. So they're different services in different hospitals, but it might be a gastro dietitian that can help you with a stoma. It's going to be very dependent. But again, the information that you're giving will be helpful, because there's lots that you can do. So there's fiber manipulation, different types of fiber. So we know sort of soluble fiber like peeled fruit, those kind of things can actually help to bulk a stool, whereas roughage like nuts and seeds and skins might push things through a bit quicker. There's also different things around fluid that can support a stoma. Some people need quite a lot of medication to help slow their gut down, and there might be vitamins and minerals that you need checked as well. So I would always ask for some support there, but there's lots that you can do. I'm just trying to think of there's another charity, a stoma charity, that will have some information as well, and St Mark's. So St Mark's Hospital is a specialist gut hospital, and I know they have some information on their website, so that might be another one to look at, definitely. But ask for the support that you need, because there should be someone who can see you.
Great. Thanks, Adele. And yes, certainly Colostomy UK have a lot of good information on their website as well. And so another question that's coming is, as a vegetarian who has some problem with pulses, protein is a problem.
Yeah, so the Vegan and Vegetarian Society websites are brilliant for supporting your body and making sure you're getting enough protein. So they have great diet sheets on their website, and then you can pick and choose some of the different proteins that you can try. Things that spring to mind are obviously soya based, tofu, those kind of things to get your protein, but also things like nut butters, so smooth nut butters that might be easier for you to tolerate rather than more high fiber whole nuts and things like that will have some good fats and protein in there. So that might be things that you could try to manage things. But yeah, they're the resources that I use to make sure. They'll also be able to, they're a great resource if you're wanting to explore more vegetarian and vegan eating, because there are different nutrients that you need to consider that you make sure that you're getting, B12, iodine, things like that. So they're another great way just to make sure. You might not really realize, oh, I've cut fish out, I need to find that iodine support somewhere else. So they can be another good port of call.
And you talked about Diet Coke and things. Somebody's asked about energy drinks such as Red Bull.
Yeah, so I mean, I'm never going to say no to anything, but usually I would suggest sort of why you're relying on energy drinks and what you're finding they're supporting you for. Any sugary drinks, I guess the other thing to watch out is for your teeth, and sometimes high caffeinated drinks can cause diarrhea, but it's more finding out sort of how they fit in, and if you're relying on them, it might be something you might want to choose something a little bit more researched, like coffee or tea if you're wanting caffeine. But again, if you're struggling with a few days after your chemo, taste changes, you want some energy, you know, it's all about moderation. So yeah.
Thanks, Adele. And
right.
Someone's asked why chemo causes a need for sugary foods.
I think everyone's different as to what they crave after their treatments. There's one, so some of the medications that you get can sort of change the way your body deals with sugar. So sometimes you prescribe steroids to reduce the nausea that you might have. So it's a preventative measure, but it can sometimes lead to different cravings. I think sometimes people also, you know, it's a stressful environment, and some people lean back on foods that they find comfort in, and that's okay to help get you through, you know, a stressful chemo day or the days after when you're feeling a bit off your game. Then those foods, you know, give you energy, but might be giving you comfort as well. So it's just as making sure you're sort of meeting your other nutritional needs, again, mainly around protein during those days, but if you're needing sugar and you're craving it, you know, it's normally just a transient thing that will resolve after a few days, and if it's not, then that's when you might be looking at whether you're eating enough and those kind of things. But yeah, I think it's more medications and stress that does it.
Thanks, Adele. Have you heard of patients taking salvestrol supplements, and is there any advice around it?
How do you spell that?
Salvestrol.
Cholesterol. Probably tell that I haven't, but I'm going to look it up. I haven't heard of anyone taking that, but I can see. So I would always get your pharmacist to double check if there's any interactions. On the further reading end slide, I've put the Memorial Sloan Kettering Hospital, which is the American-based sort of integrative therapy place that has a list of all, well, many supplements, pros and cons to supplements, interactions, those kind of things. So you can have a little bit of a read around that, and then possibly direct your health professional to it to see if there's going to be any interactions. Just a rescue. I mean, there's always research ongoing, but my fear around supplements that aren't prescribed are that it's hard to know the research that backs them up. We worry that what's in the bottle isn't what's necessarily on the label. The regulations are a lot different. So it's all about sort of making an educated decision about the risks and where you are in your treatment. If it's something you might wait until after you've finished, or if it's going to be something that might be absolutely fine, but we're just cautious about it. So unfortunately, I haven't heard of that one, but I'm going to look it up more.
Thanks, Adele. How safe are meat substitutes, particularly vegan butter?
Vegan butter? What's in vegan butter? I think there's two sides to every story. So a lot of the vegan substitutes are heavily processed. So when you're looking at different things, it's kind of about making a decision about what's important to you and what you want in your diet. I would always check your label and see what's actually in there. So vegan butter, I'm guessing, is a fat that's kind of been processed, or it could just be a margarine with lots of salt in it. So most fats, we're looking for no trans fats. Most products shouldn't have that in the UK, but they're not having to put it on the label. And we know that trans fats can have an effect on our heart health and our cancer risk. So it might be just having a look at the label and seeing what's in it, how processed it is. But it's also making a decision about how often you're going to have it. You know, if it's for your Saturday breakfast, then once a week, it might be something you want to include compared to something that you're having every day. So it's always different. But I'm going to have to look up vegan butter as well now.
Thanks, Adele. Someone's asked, how do you lessen the metal taste in your mouth throughout chemo?
So taste changes are probably one of the most reported side effects from cancer treatment, and one of the least treated. So the taste and flavor changes that you have are affected by both knocking out smell and taste receptors in your tongue. When it's metallic taste, it might be, some people find using plastic, or in this modern world, bamboo furniture, cutlery might help rather than metal. There's a link on the further reading for Life Kitchen. So they're a charity that does lots of recipes for managing taste and flavor changes for cancer treatment. They've got a few free cookbooks online. They run some cooking classes. So it's sometimes about experimenting with different things, keeping hydrated, using sort of water, baby toothbrush if your mouth's really sore, and sometimes make sure there's nothing else that could be causing it. So some people get oral thrush due to their chemotherapy, or high blood sugars, those kind of things. So just make sure there's no reason that could be causing the taste changes as well. But yes, try the bamboo cutlery.
Thanks, Adele. Someone's asked, why do we feel full quickly?
So there's lots of reasons that can happen as well. The most common one that I see is that our bowels aren't emptying properly or completely, and that can be for a lot of different reasons. So some of you might find you've got quite a bit of a sore tummy. You might have a bit of disease in there that's affecting the way that your bowel works, and that can make your stomach or your tummy feel fuller. Sometimes it can be that you're needing to take something to help move your bowels through. You might have fluid in there. So some people have ascites or fluid in their tummy that presses on their stomach. So literally they've got less room for things. And if you're finding that's a common thing, I would always ask for a referral for someone who could help you explore the reasons for that. But in the meantime, the sort of nutrition support things around boosting your diet can be helpful, and having more liquid nutrition or soft, sloppy foods that are easier to get down whilst you're waiting to see what can be done. Again, dairy or dairy alternates are a great way to do that. Yogurt, full fat yogurt, custard, ice creams, those kind of things, milky drinks. That's where you might have some prescriptions for 46. That can cause things there. Sometimes it can just be nausea around chemotherapy, and it might be that you need to take some medication. But it's something that I'd always ask for support for it to see what can help, because there's usually things that can help.
Great, thank you. You spoke about caffeine earlier. Someone's asked, what about coffee, decaf, caf? So I'm wondering if, in addition to sort of caffeine information that you've given, I think sometimes people have concerns about the process of
Caffeine.
And
the chemical. And I think there's no evidence to show that there's an issue with decaf. A lot of people rely on decaf especially if they've got taste changes and water isn't meeting their needs, but the caffeine's affecting their sleep, then decaf's going to be a better option. So there isn't an exact answer. It's going to be what works for you, but there isn't any evidence that the processing that takes the caffeine out has any impact for you. And caffeinated or decaffeinated drinks will still provide some fluid for you. Maybe even milky coffees could be a real nutritious way of getting some energy in. But if it's interfering with your sleep, then I would suggest decaf. So it's just kind of making the choice about what you need at the time.
Great, thank you. Someone's asked if there are any foods you'd recommend to avoid.
So I think there isn't. No foods I'd recommend to avoid. All food has a place. And it's just making sure you feel comfortable eating what you are, that you're meeting your needs. And the only ones that there's a little bit more of a limit on is the booze.
Okay, thank you. Someone's asked about simple foods to relieve chronic tiredness. And it seems to be, at the moment, they seem to have a never-ending cycle of being too tired to cook a decent meal. And so therefore, they're tired.
That's a great question, because it's so often that we feel the need that we have to cook all of this glamorous, amazing food from scratch. But actually, the ready meals, takeaways, you need the nutrition in there. So it's making the most of what you need when you can. And actually, the knock-on effect from being well nourished means that you might have more days when you feel better to cook. So it's supporting your body at the time. And if your symptom is tiredness, but you're struggling to make the food to eat, you need a ready meal. You need that to get that energy in, and then hopefully you can do a bit more and help to build from that fatigue. So don't feel the pressure of needing to cook home cooked meals. Some people might be relying on, if it can be a good one actually, if people are like, what can I do to help? Bring me a lasagna. Those kind of things can be helpful. Lots of people want to help us, and actually for them to bring a meal over can be an easy way for them to feel they're doing something to support you, but also you get the benefit of it. Other people will find that they'll have a few days where they feel better and they'll bulk cook and put things in the freezer, and that's the same. Fresh, tinned, frozen veg are all fine. They've all got benefits, so don't feel that you need to cook a big meal all the time. And in fact, snack meals are the other thing. Toast, something, beans on toast or nut butters on toast, those kind of things can give you a little bit of energy without taking too much energy to make.
Great, thanks, Adele. I think we've come to the end of questions. We have 15 minutes left, so if anybody has any questions, please do drop them in the chat and I'll ask, or if I've accidentally missed your question, I do apologise, and please do give me a prompt in the chat. So we'll just see if any more questions come in. But Adele, was there anything that you wanted to come back to at all, or mention that you didn't have a chance to so far?
I don't think so. I'm hoping I've given you sort of a whirlwind tour through sort of eating well, and the fact that it's going to be different for everyone, and to make sure that you always do ask for help if you need it. I can see a few questions coming in now.
Okay, so is tinned fruit better than fresh fruit, and same with frozen veg?
So there's all benefits. So I would pick what you can choose at the time. So usually if you've got a few days of fresh fruit and then you're relying on frozen and tinned fruit for the rest till your next shopping cycle, then that's a good thing. So frozen foods are generally sort of frozen on site, so they're quite nutrient rich. Tinned fruits have some benefits too, and often they're less fiber. So if you're because they're often peeled, And that might be something that if you're following a lower fiber diet at certain points that you might lean on a bit more. If you're needing more energy, you can go for the syrupy ones compared to the juice ones. So whatever you need and what's easier for you at the time, there's going to be benefits, and they all count towards 5 a day, fresh, tinned or frozen.
Great, thank you. Someone's asked, what can I do to help with menopause weight gain?
So our bodies change as we get older, and our bodies like to store fat as we get older, and that's a natural process that unfortunately we're kind of pushed against too in the way that we're sort of fed through our lives. So I would always focus on being as fit and well as you can, rather than specific weight. So often when we're trying to focus on weight, we'll restrict our body. And for many of us, if we restrict, that will involve our body storing, which will actually have the opposite effect of what we're feeling that we need. So making sure you're having regular meals, adequate protein, again, is another important nutrient, that you're getting enough energy, fibers to help support your body. But we also know moving is really important when it comes to getting older and having menopause, and going through treatment. So it all sort of feeds into the same thing. Any movement that you can do is going to be a bonus, especially weight, what's the word? Weight bearing. So any weight bearing exercise that we can do can even be things in a chair, tins of beans that you're about to eat, or tins of fruit. Anything that you can do will be a helpful thing. And it's starting small, so might be 5 minutes a day and building from there. But that will help support your body's muscles, which will support your body to help you feel a bit better, whatever your weight. So it's kind of taking a different mindset from there.
Someone's asked, are Chinese food cravings okay?
Of course. Definitely.
Okay.
Definitely. I mean, if someone was worried about having, I think it's normally sort of exploring frequency of things, and if you're enjoying the Chinese food, but making sure you could, if it's something that you're including more of, experimenting with different options that are available. But again, if you're needing it for, you're tired, it's takeaway after your chemo, then, go for it, enjoy it, dig in. Prawn toast. I love prawn toast.
Someone's asked, how long can you take stool softeners for?
So that's an indefinite question. Everyone's going to be different, and many people will need them long term, if not forever, depending on the treatments that they're on. So again, we often, and I think someone's just asked about constipation as well, is there's different types of laxatives. So there's pushers, there's softeners, there's other sort of osmotic ones that draw more water in. There's different types of laxatives, and I see lots of ladies that actually need 3 different types to help move their bowels, especially if they've got quite a bit of disease in their tummy. It can actually really mean that they rely a lot on laxatives, especially if sort of more fiber might actually increase the risk of sort of a blockage for them. So everyone's going to be different about what they need to take. Fluid helps bowels as well, so it helps the laxatives work, and also just helps them in general. So does physical activity, so literally moving your body will move things through, because your bowels are a muscle. And any sorts of fiber that you can have safely is another important one. So often people will find things like pulses, lentils, nut butters easier, but if you struggle with those, it might even be peeled fruits, watermelon. They've all got types of fiber in there that will help support your bowel. So it's working with whatever you can manage, or whatever you're sort of allowed to have within your restrictions.
Thanks, Adele. Someone's asked if stress can increase calorie requirements.
I would say yes, because some people find that it changes them physically. So very much so, and how our bodies react to stress can be very different. Some bodies will sort of shrink, or some will grow. Everyone is different, but it's finding a way to support your body through that stress, which often is sort of eating what you can, but then looking externally for support for the stress, rather than trying to manage things with food, if that makes sense. So it's you utilize your support services there, because you shouldn't have to suffer through that stress alone.
And someone's asked if the nutrients will be any less if they drink fresh fruit juices rather than eating fruit as it is.
Good question. So there'll be a lot less fiber in fruit juices. So for some people, that's a good thing. But for many of us, we'd want to rather eat the whole fruit. But there's definitely a place for juice. It's not a superfood, as sometimes it's sort of touted, but 1 serve of fruit juice still counts as 1 of your 5 a day. And it's still going to have vitamin C in there, but it's just not going to have as much fiber, if any, because of the processing it goes through. And it can be quite energy dense, but that might not be a bad thing. I've just seen someone ask about fiber increasing the risk of blockage, and that's only if you have sort of that already shown up as a risk for you. For someone who has quite extensive advanced disease, it might be a risk for you. So it's only something that, don't worry, for many people, fiber is absolutely fine. But for some of us, it can cause problems, but you will be told that if there was any risks. But I'm sure everyone in this room is in a different situation. Hopefully that clears that up.
Yes, that's sort of, there were a few that came in around fiber. So the that have come in were what foods are good for constipation. I have constipation after chemo and take laxatives, but perhaps some foods will help. Then someone else, constipation can be helped by fiber, or fiber can be a disaster. How can we tell which one? And why does fiber increase the risk of blockage? So we've had a few just come in then about.
So I think it's very different for everyone, and a lot of the time, for most of us, fiber is a great thing, but unfortunately for some ladies with advanced disease, it can be something that could cause a blockage. So it's something that I generally see sometimes in clinical practice, and it's just that the bowel isn't working normally, so that's why it's not functioning normally. Similarly, how we would modify fiber with a stoma bag, it's just modifying things differently, and you would definitely be told if that was something that you needed, and you should have support of a dietitian.
Great, thank you, Adele. We've probably got time for 1 or 2 more questions. I'll say 2, we'll risk 2. So anyone has a question that they'd like to ask Adele, now is the chance before we go on to our next sessions at 11:30. So let's see, but I'll just while we're waiting to see, I'll just mention some of the comments that have come in. So someone said they used Couch to 5K and that it's really good, and someone runs 3 times a week to help. So there's sharing some tips in the chat, so do have a look at the chat, everyone, if you get a chance, because there's also some links that my colleagues have dropped in there as well for useful information. Okay, well, it looks like we're coming to the end. People are saying thanks ever so much, Adele. So
great,
and I'll just echo that. So
thank you so much.
Quick question. So will the fiber be less if we make the fruit juices at home?
So it depends if you have a smoothie. So that's the difference between a smoothie and a juice. So traditionally a juice sucks out all the fibers and puts it in a nice thing that you have to clean, compared to a smoothie maker that will put everything in the same thing, but it's effectively broken apart already. And I mean, if you leave smoothies, they go all like jelly and that's actually the fiber in there. So there is still fiber in there, but it's kind of broken up and a lot easier for us to get in really fast. So it just depends on your needs as to what you need there. So hopefully you've all found the session helpful. Any other questions, do ask, or if you guys get any afterwards, I'm happy to send some information across.
Thanks, Del. We've just had one more comment. Right. I can't take milk. I can't take milk, so is it safe to drink coconut or soya or oat every day?
It definitely is, and out of that, soya is the only one that's going to have the same amount of protein, but coconut and oat will definitely, as long as they're fortified, have calcium and vitamin D in there. So have a variety, I would say. Okay. Enjoy whatever you like.